Hello everyone, my name is Travis Sauter, and I've completed my fieldwork semester at Alpha Center with my supervisor, Nisa Oliver. In this video, I'm going to provide a brief overview of my special project in which I utilized Voodoo Floss compression bands as a treatment modality. Alpha Physical Rehabilitation and Health Center is a primary care physiotherapy clinic in Regina. Patients typically present with work or motor vehicle-related musculoskeletal injuries. Over the course of the semester, I screened for patients who are eligible to take part in the Voodoo Floss compression band trials. Qualified patients were educated about the treatment method and administered a consent form prior to the application of treatment. Although generally safe in all populations, patients were deemed ineligible to take part in the trial if they had any cardiovascular pathology and/or peripheral circulation concern. Early on in my fieldwork placement, I noticed that patients were usually encouraged to rest and ice an injury. Although prudent in some instances, if this protocol is prolonged following the acute stages of an injury, patients will experience maladaptive adaptations, which are illustrated by Davis's law. The soft tissues of the body adapt to imposed demand. This adaptation works both ways, meaning that if these tissues are exposed to too little stress or stimulus, they will adapt to the lower demand. This negative adaptation commonly occurs in the muscle and tissues that act about an injured joint. In these instances, Voodoo Floss compression bands can be enormously beneficial to help remobilize an injured joint or muscle. In order to apply, one wraps the 2-inch wide and 7-foot long dynamic rubber band around the affected muscle or joint, wrapping towards the heart. Compression is applied for about 2 minutes or until the patient tolerance is met. The shearing forces created by volitional patient movement during application will help restore the sliding surfaces of the underlying tissues. The compressive forces provided by the band will create a flexion gapping moment at the joint and temporarily occlude blood flow to the tissues. The latter effect will create a rush of blood flow to the area once the band is removed, thereby aiding in arterial, venous, and lymphatic circulation, reducing swelling, and increasing range of motion about the joint. The result of my trials concluded that the effectiveness of Voodoo Floss compression bands were largely dependent on the nature of the injury being treated. Muscular strain showed the greatest benefit from the treatment application. However, patient perceived benefit of the treatment and an observed reduction in swelling were noted across all trials. There is currently very little research regarding Voodoo Floss-Banded compression, and most existing studies suffer from methodological error. Having the opportunity to implement my trials within a controlled environment has been very beneficial for my progression in prescribing, administering, and monitoring unique treatment protocols. This project allowed me to work one-on-one with patients and apply critical thinking in a practical setting. For my agency and myself, Voodoo Floss compression bands are a treatment modality which can continue to be implemented to great effect given the appropriate circumstances are met. Thanks for watching.